this quick overview of HeRO monitoring. HeRO identifies abnormal heart rate patterns that are early indicators of infection and other forms of distress in neonates and has been proven to reduce mortality. I'm Will King, CEO of Medical Predictive Science Corporation, and I look forward to telling you how HeRO monitoring can benefit you and your patients by helping you diagnose infection earlier and treat more effectively. Throughout this video, you will see references to peer-reviewed journal articles that substantiate the contents of the slides. Let's get started. Our heart rate is constantly regulated by the autonomic nervous system. The parasympathetic branch is your rest and digest response and is always seeking to slow the heart rate down, while the sympathetic branch is your fight or flight response, and it is always seeking to accelerate the heart rate. You see this if you walk up to the physiological monitor in the NICU on a healthy patient and just watch the heart rate. You'll see it bouncing up and down. It's 150, 154, 148, 142. Up and down as it is constantly reacting to the inputs that the heart's pacemaker is receiving from those two branches of the autonomic nervous system. This results in a healthy balance between accelerations and decelerations, as we can see in this histogram. Early in an infection, cytokines are released and act as the mediators of the inflammatory response. These cytokines have effects throughout the body. They cause the bone marrow to start producing more white blood cells. They cause your muscles to become feverish and achy. And somewhat surprisingly, one of the areas of the body they also impact is the SA node of the heart. And they change the way the pacemaker of the heart responds to the inputs that it receives from the autonomic nervous system. In the presence of these circulating cytokines, the heart's pacemaker changes the way that it reacts to these inputs, and the variability tends to diminish. That is, if you were to walk up to the physiological monitor and watch the heart rate of a baby in the days or hours prior to the diagnosis of infection, you would see the heart rate pegged at one value over and over again, maybe 150, 150, 150. When it does change, it's what we call a transient deceleration. It's a subtle bradycardia that may not set off any alarms, but the important thing is that it's a deceleration without any corresponding acceleration. So you might see the heart rate change from 150 down to 120 and then back up to 150 again. Two important things to note are, first, that there's been an overall reduction in variability that can be seen as a more narrow histogram. And second, there is no longer a balance between accelerations and decelerations as indicated by the tail on the deceleration side of the histogram. Researchers made this observation that abnormal heart rate patterns were occurring in the days and hours prior to infection, and they developed algorithms that quantify those abnormalities, such that every hour, for every patient in the NICU, a HeRO score is generated. The HeRO score is calibrated such that a score of 1 indicates normal risk of infection. Anything below 1 indicates a below average risk of infection, and these will make up 70% of HeRO scores. A score between 1 and 2 is an intermediate risk of infection and make up about 20% of HeRO scores. Finally, the worst 10% of HeRO scores will be above 2 and indicate a high risk of infection for that patient. So it's very clinically intuitive. If you've got a patient that's got a HeRO score of 3.9, that means that that patient is about 4 times more likely to get an infection in the next 24 hours than they should be. It's just that simple. Most of our customers chart HeRO just like they would any other vital sign, and we wouldn't tell you that a rising HeRO score in an otherwise healthy-looking patient is a diagnosis per se. Rather, it is a call to action to take another look at that patient, get lab work, perform a physical exam, have a discussion with the other caregivers or parents about what's going on with that patient. And if there are any other signs of deterioration, then at that point, go ahead and do the sepsis workup and start antibiotics. Now, it is our belief that all infection, particularly sepsis, gets diagnosed eventually. It's a question of timing. And with HeRO, we believe we can improve the timing of the diagnosis and allow you to make it down that diagnostic cascade earlier than you would without HeRO, and initiate antibiotics when they can be at their most effective, before the infection has gone systemic, before organs start shutting down, before we have the really bad outcomes. Here we see a patient whose HeRO scores were not displayed to caregivers, but whose scores spiked 3 times in the 4 days prior to the diagnosis of infection at the yellow line. These early rises in HeRO score represent opportunities for an earlier diagnosis, earlier treatment, and improved outcomes. We put that idea to the test. We did a 3,000 patient randomized control trial at 8 study centers where half the patients were randomized to receive standard of care and half the patients were randomized to receive standard of care plus HeRO monitoring. And then we tracked outcomes differences between the 2 groups. The headline news was that those patients that were randomized to receive HeRO monitoring had a 22% reduction in all-cause mortality. And in fact, that was a 40% reduction in mortality after infection, where 1 life was saved for every 48 very low birth weight patients that were monitored, or every 16 infected very low birth weight patients that were monitored by HeRO. The mechanism was not that HeRO averted infection. Instead, HeRO caused the timing of the diagnosis of infection to be improved. As we can see as we revisit this slide, many patients whose HeRO scores were not displayed had higher HeRO scores in the days prior to diagnosis. These were lost opportunities to make the diagnosis earlier. When patients' HeRO scores were displayed, the timing of the diagnosis was improved by about 16 hours on average. And again, starting the antibiotics earlier when they can be at their most effective led to the improved outcomes. HeRO allowed caregivers to diagnose infection earlier and thus treat more effectively. HeRO is a simple adjunct to your existing physiological monitoring systems. HeRO has no direct contact with the patient. Instead, we take the heart rate data that you are already acquiring on your patients and run it through algorithms to compute new clinical information. Your physiological monitors already alarm if the heart beats way too fast or way too slow. We can plug HeRO in and calculate a new clinical score, looking for those patterns in the middle that indicate infection and distress. It's a new piece of information that you can use to make a difference. Thank you for your time watching this HeRO overview. To get more information, please contact info@heroscore.com to be put in touch with your local distributor. HeRO is simple to install and use. It's inexpensive and it saves lives. Let's get started in your NICU today.